Principles of Radiographic Diagnosis of Dental Caries in Children. Dental caries in children. Dental caries is one of the most common diseases of childhood. 60% of all Canadian children experience dental decay, and more than 2 million school days are missed annually due to dental sick days and dental visits. Timely diagnosis of dental caries provides the best opportunity for interventions to minimize the progression of the disease and mitigate the risk of sequelae. Dental caries progresses more rapidly in primary teeth than permanent teeth as a result of thinner and less mineralized enamel compared to permanent teeth. Bite-wing radiographs remain the key tool for diagnosis of interproximal dental caries in the buccal segments of a non-spaced dentition. Using radiography to detect caries. In a radiographic image, areas of demineralization do not absorb as many X-ray photons as sound enamel. The result is more photons striking the imaging plate, and thus a carious lesion can be identified as a radiolucent, dark zone on the image of a tooth. Radiographic images tend to underestimate the extent of demineralization in an interproximal lesion. This chart demonstrates the progressive radiographic changes observed in enamel and dentin of an untreated carious lesion over time. FDI notation system. The World Dental Federation (FDI) notation system is used to identify both primary and permanent teeth. The first number identifies the quadrant, 1 to 4 for permanent teeth, 5 to 8 for primary teeth, and the second number indicates the tooth, 1 to 8 in permanent teeth, 1 to 5 for primary teeth. Identifying carious lesions by location. In primary teeth, the common locations for dental caries include interproximal, occlusal, buccal, and lingual surfaces of the tooth. Each lesion has a characteristic radiographic appearance. Reporting the location of carious lesions. In a radiographic report, the location of a carious lesion is reported by stating the tooth number followed by the surface of the tooth where the lesion is present. The occlusal image on the left demonstrates dental caries on tooth 5-1 mesial into dentin and 6-1 mesial into dentin as indicated by the arrows. The bite-wing image on the right demonstrates dental caries on tooth 7-4 distal into dentin and 7-5 mesial confined to the enamel as indicated by the arrows. Interproximal lesions. An early interproximal lesion tends to appear as a triangle with its apex pointing towards the dentino-enamel junction. As the lesion progresses, it spreads along the DEJ and forms the base of a second triangle with its apex pointed towards the pulp. The lesion in tooth 8-5 demonstrates this classic double triangle appearance of an interproximal lesion. In interproximal lesions, the lesions are most often found in the area between the contact point and the free gingival margin. Occlusal lesions. Occlusal lesions are the most common type of lesion in both children and adults. They typically present as broad-based, bowl-shaped radiolucent regions underneath a pit or fissure. Buccal lingual lesions. Buccal and lingual lesions typically occur on smooth surfaces of primary anterior teeth in cases of severe early childhood caries. They tend to appear round, elliptical, or semilunar with sharp, defined borders. Secondary recurrent caries. A carious lesion that has developed at the margin of an existing restoration. Primary tooth anatomy may mimic caries. In this image, the areas identified by the arrows in tooth 5-4 are less dense due to the natural contour of the tooth, resulting in differential thickness of enamel. The dark triangles are consistent with normal tooth anatomy, as highlighted in the diagrams. This area may be mistaken for dental caries on a radiograph.